Parkinson's disease is one of the fastest growing neurological conditions in the world, causing symptoms such as tremors, stiffness, and difficulty with movement. Around 145,000 people live with Parkinson's disease in the UK. Today we're going to explore the causes, pathophysiology, symptoms, diagnosis, risk factors, and treatment options for those people who suffer with Parkinson's disease. So what are the causes of Parkinson's disease? There is a part of your brain which helps to control movement called the substantia nigra. In people with Parkinson's, there is degeneration of nerve cells in the substantia nigra. These nerve cells become damaged and they stop producing a chemical called dopamine. Dopamine works in balance with other chemicals to allow messages to be sent to the parts of the brain that coordinate movement. It is particularly important in sending the signal to start or change a movement. When you don't have enough dopamine, these parts of the brain cannot work, resulting in changes in movements like tremors, stiffness, and slow speed. And these are really common symptoms of Parkinson's. Dopamine levels continue to reduce over time, which causes existing symptoms to worsen and new symptoms to develop. The exact cause of why the nerve cells producing dopamine stop working is unknown, but current research theorizes that it's due to a mixture of genetic and environmental factors, including head injuries and certain medications. In terms of diagnosis, there is no one specific test for diagnosing Parkinson's disease. Instead, a diagnosis is based on a combination of assessments and tests, which include the following. Number 1, medical history, and probably the most important. Doctors will take a comprehensive history of symptoms, past medical history, and a full physical assessment. Number 2, blood tests. Your doctor may use blood work to support a PD diagnosis or to rule out other medical conditions that mimic Parkinson's. Number 3, brain scans. Scans such as MRI or a dopamine transporter scan can support a PD diagnosis and rule out other conditions. Now, although it's still unknown what triggers Parkinson's disease, there is evidence to suggest that genetic and environmental factors could play a part. There is research to suggest that environmental factors such as toxins may cause neurons that produce dopamine to die, leading to Parkinson's, although more research needs to be done in this area. Certain genetic factors can also make someone more likely to develop Parkinson's. However, it is extremely rare for this to happen. The most common genetic cause are changes in the LRRK2 gene, and this is a large protein that's found in nerve cells in the brain and also other organs, including the heart, kidneys, and lungs. Genetic changes can either cause Parkinson's directly, or they can increase your risk of having Parkinson's. So moving on to symptoms, there are over 40 symptoms for Parkinson's disease, and they're usually referred to as motor or non-motor symptoms. Motor symptoms affect your balance and your movement, whilst non-motor symptoms affect you in ways that other people might not see. They include pain, sleep problems, and mental health issues. The main symptoms of Parkinson's disease tend to affect your physical movement, and there are usually 3 main features. The first is tremor. Tremor is shaking, which usually begins in the hand or the arm, and it's more likely to occur when the limb is relaxed and resting. The second is bradykinesia, which means slowness of movement. Physical movements are much slower than normal, which can make everyday tasks difficult and result in a distinctive slow shuffling walk with very small steps. The final is rigidity. This is stiffness in the muscles, which can make it much more difficult to move around and can result in painful muscle cramps called dystonia. There are many other symptoms of the disease, and they include balance problems, which can put people at high risk of falls and other injuries. People can also develop a loss of sense of smell, sometimes occurring several years before other symptoms develop. There's also nerve pain, which can manifest in different ways, including burning, cold, or numbing sensations. And people can also have problems passing urine or find they go more frequently or can't control their bladder. You can also have constipation, excessive sweating, swallowing difficulties, excessive production of saliva causing drooling, and problem sleeping. Some men may also have an inability to obtain or sustain an erection, and this is called erectile dysfunction. And some women may find it more difficult to become sexually aroused and achieve an orgasm, and this is called sexual dysfunction. There can also be cognitive and psychiatric symptoms, and they include depression and anxiety, mild cognitive impairments, which can include slight memory problems and issues with activities that require planning and organisation. People can also develop psychiatric symptoms, which include more severe memory problems, personality changes, visual hallucinations, and delusions. People will have different experiences of their condition depending on how it presents and how it changes over the disease course. How Parkinson's affects someone can change from day to day and even hour to hour. Now, whilst there is no cure for Parkinson's disease, there are a bunch of different treatments that can help manage symptoms effectively and improve your quality of life. The three main treatments to help Parkinson's disease are medication, physical activity, and therapies. Everyone's Parkinson's is individual, so different combinations of these treatments will suit different people. There are a lot of different types of drugs that can help to manage the symptoms of Parkinson's disease, but they will usually do one or more of the following things. Number 1, increase the amount of dopamine in the brain. Number 2, act as a dopamine substitute, stimulating the parts of the brain where dopamine works. And number 3, block the action of other enzymes that break down dopamine. Your neurologist will work with you to figure out the best medication and dosage for you, taking into consideration the side effects, severity of symptoms, and impact on your life. There are also a bunch of other therapies that can help people manage their symptoms. These include physiotherapy, occupational therapy, and speech and language therapy. A physiotherapist can help you manage your movement difficulties and support an increase in your physical activity. And it's recommended that people with Parkinson's do a minimum of 2.5 hours of vigorous physical activity a week. An occupational therapist can support in helping manage daily tasks, whilst a speech and language therapist can support with swallowing issues or difficulties with communication, speech and writing. The main treatment for Parkinson's is medication. However, some people may be offered deep brain stimulation or DBS if drug treatments become less effective in managing your symptoms, particularly motor symptoms. So essentially, a pulse generator, which is a device like a heart pacemaker, is placed under the skin around the chest or stomach area. It's connected to 1 or 2 fine wires that are inserted into specific areas of your brain. And when the pulse generator is switched on, the electrodes deliver high-frequency stimulation to the targeted area. This stimulation changes some of the electrical signals in the brain that cause the symptoms of Parkinson's. It's important to note that DBS is not a cure and it doesn't stop disease progression. However, it can improve people's quality of life significantly by giving more control over symptoms. So in summary, Parkinson's disease is a complex condition with many symptoms associated. However, although there is no cure, the symptoms can be effectively managed through different treatments, including medications, therapies, and physical activity, and people can lead full lives. We hope you found the information helpful and see you next time.